Meet Gabrielle. She's just finished her infectious diseases ward orientation last week. This week, she is halfway through her 5th night shift. She is very busy. She hasn't had time to do her safety checks. She's been allocated a middle-aged man who's known for his agitation and aggression. His line occludes and she rushes, doesn't communicate or request assistance. She uses inappropriate equipment and decides not to use appropriate PPE or night lighting. She startles the patient, causing them to jerk, and ends up with a needle stick injury, contaminated with blood from end-stage liver failure patient with hepatitis C and HIV. She didn't tell anyone out of fear of damaging her reputation with her colleagues or fear of letting them down. With this poster, we will now work through the quality and safety issues to identify the cause, analyse the information and data, and create and evaluate interventions using the Cleveland government's tools, frameworks, so we can make Gabrielle's story a lesson. Identify. Looking at the Swiss cheese model, we can identify the things that lead to the outcome in a systematic way. Each time an area progresses through another layer of risk protection, e.g. infection control, the higher the risk of the error causing an adverse effect. But by identifying the holes, we can work out how to fill them in the hope that we can reduce or prevent them from slipping through again. Education. New graduate moving from academic to practice nursing is like moving from Mozart to jazz. Whilst university sets us up for the ideal, learning to respond and manage the realities takes time and practice. Training. Infection control. For HCV and HIV, which are blood-borne viruses, proper infection control practices and precautions are needed. Policy. New graduates on night shift. Night shift is hard enough on the mind and body at the best of times, I know. Let alone working with no educator available, and reduced staffing makes it difficult for a new graduate to practice and learn from others, or even find anybody free and willing in a timely manner when the shift is busy. Technology. Gabriella is new to the Interlink IV cannula equipment and parts, new to the IC system, and is not familiar with the location of the protocols. Communication. She's frightened to communicate. We only want to present our best side, but I found being honest and upfront means your team can trust you instead of asking you if you're okay every 5 minutes. Every nurse buddy I've had has advised that this is the novice nurse's problem. Those who don't ask questions are the ones to worry about. Checklist. Not done. There is a reason for every checklist. Each item has saved a life or avoided a near miss. If you compromise, you are being complacent and setting yourself up and your patient for unnecessary risk or injury. The 3 buckets model. It's a method for identifying risk. The 3 buckets include self, context, and task. Self, little experience on the ward, unfamiliar with Interlink cannula device, and scared of asking for help. Context, very busy, few accessible or familiar supports, low light, not enough PPE. The task is to troubleshoot the device, correct the occluded IV line with the correct cannula device, and ensure the patient is safe and the IV is continuing unoccluded. All of these risk factors fill your buckets, and Reason 2004 states that the fuller buckets they are, the higher the risk is. This method gives you a quick self-assessment tool for situational awareness. Night shift has been identified across many sectors and through many different health philosophies for a long time as increasing the potential for adverse health effects related to poor sleep quality, increased fatigue, cardiovascular effects including hypertension, poor nutrition leaving them at higher risk of type 2 diabetes, not to mention the adverse effects on social, emotional and mental health. Lack of sleep leads to an array of adverse health effects including a decrease in alertness, poor concentration, poor memory recall, and consequently poor decision making and an inability to properly engage appropriately and with the correct coping strategies. Analyzers. Looking at the causes as identified by the fishbone model. People in person. Fatigue. Gabrielle is halfway through her 5th 10-hour night shift. Inexperience. It's her first week on the job, as last week was her orientation. Lacking knowledge. Limited exposure to systems and processes. Poor communication skills. She assumed that she couldn't ask for help. Failed to complete safety checks. Equipment not available when needed. Insufficient clinical reasoning and rationale ability. For example, she was more worried about the aggression potential than the lighting and the proper due process. Fearful of co-workers' reaction/perception. She was more worried about her co-workers labelling her as incompetent, unsafe and useless. Place and environment. Bedside equipment stores depleted. Lack of support from buddy, nurse in charge or educator. Busyness of the ward. The ward was very busy tonight. Staffing. A mix of appropriate experience allocations and rostering. Procedures. Ease of accessibility. Ability to retain multiple procedures when taught at once. Competing priorities. Failing to perform bedside safety checks. Policies. New graduates on night shift on their first rotation. In my graduate research, usually new graduates are only allocated to night shift after a minimum of 8 months. Supports available to new grads. Where is the support available at 3 a.m? Appropriate patient allocation. Patients who are known to exhibit agitation and aggression would be better suited to a more experienced nurse. When we look at human factors, we need to look at the system, the team and the individual. In relation to the system, night shift just doesn't have the supports required for new graduate nurses, making them unsafe. Team. Night shift has less staff and therefore less availability for the assistance and supervision of new graduate nurses' needs. Individual. Knowledge, limited. Skill, novice. Rule, new graduates are unfit for night shift. Coping with the demands of a new role with new colleagues in a new facility in a new context is challenging to say the least, but add to that the mental and physical load of overturning your circadian rhythm without prior experience or a buddy nurse is detrimental to good clinical decision making and risk management. Both memory retention and recall is under strain. Communication and teamwork frameworks, having a no blame policy, mandatory reporting of hazards and risks, open disclosure with patient-centered care, and providing interdependent allocation for formal query and discussion. Interventions. Interventions that can be used for communication teamwork framework are such things as CUS. I am concerned, I am uncomfortable, this is a safety issue. Or desk script. Describe, express, suggest, and consequences. Appropriate risk management tools. Educating people on how to use self-assessment tools, such as the self-hours tool developed by the ANMA. Continuous improvement frameworks. Team steps, strategies and tools to enhance performance and patient safety. Quality improvement strategies. Roster new graduates on AM/PM. Shifts to maximise their contact with educators and clinical supervisors until competencies are improved and validated. Audit shift commencement safety checklists to understand if it's appropriate and effective. Gather data relating to risks and adverse events, including a trial period related to new graduates on night shift versus errors made during day shifts. Appropriate health education to night shift workers, all night shift workers, including diet, exercise and sleep hygiene. Evaluation. For evaluation, we're using the PDSA method. Plan, do, study, act. With plan, we look at the why, who, what, where and when. We look at why. Well, we've got increased risk factors. Who? The new graduates. What? It impacts performance, job satisfaction, health, safety and quality. Where? Generally at the bedside. When? During night shift. So what are we going to do about it? we're going to propose a change of roster to maintain patient and staff safety as well as continuing the quality of care. We're going to have a review of the 2019 graduates. We're going to ask them to do a survey. We're going to monitor the performance and risks by the new graduates that are on night shift versus the ones that are permanently on day shifts. We're going to collect the data including Riskman and VIMS records. To study, we're going to reflect on that data. We're going to review the data. We're going to look at how and what surprised us. We're going to act on those. We're going to implement a trial change. We're going to monitor and evaluate. Not all changes are improvements. We're going to have a look at the effectiveness of the process. We're going to adapt, which can improve processes. We may adopt some of those implementations, or we may discard them as ineffective.